Hi there, how you doing? This is Doc J. Zimmerman, and today we're going to continue our discussion on chiropractic and some of the important parts of chiropractic that you may not be aware of, how it affects your overall health over time. So we're going to read from my book, Chiropractor's Patient Education Course. We're going to go to Chapter 9, Spreading the Word with a Tire. Now, here's my tire, and I use this as this is a very good teaching tool, and you'll see in a few minutes how this is going to explain an important concept in chiropractic. So what I would do is I would give you this tire, and I would say, let's imagine that this tire is a wheel on your car. Please take a look at it and try to see if there's anything wrong or different with this tire that, say, you wouldn't want on your car tire. So my patients will grab the tire and they'll flip it around, they'll look at it, and they'll say to me, well, this one side of the tire is worn out. The tread is worn down. It's very smooth. And they'd be right. So my follow-up question would be, other than old age and overuse, what's the number one cause of a worn out tire? And as you're guessing right now, is the number one cause is that your wheelbase is out of alignment. When your wheelbase is out of alignment, it causes an excess friction on your tire and on the road. And over time, that excess friction wears out the surface of the tire. It erodes the surface of the tire. And now that sets you up for a big problem with a tire pop and a flat tire. So, or even worse, you could be driving at high speeds when something like this happens, and that's really bad. So you've got a couple options here now when you have a worn out tire like this. The one option is you can just replace your tire and you'll get a nice shiny new tire. And what do you think happens over time with that if you don't correct the alignment? Well, naturally your tire is going to wear out again and we're going to be in the same situation. So what the goal here is in this worn out tire is you want to correct the alignment. You want to get that wheelbase level. You want to get it all aligned properly so that there is no more excess friction on the tire and in the road, so that we don't get this degeneration or this erosion on the tire, and then your tire lasts longer. So what does this have to do with chiropractic? Well, it has a lot to do with arthritis. There's many different kinds of arthritis. A lot of arthritis conditions are what we call autoimmune. They come from within. They're a blood disease like rheumatoid arthritis or lupus or gout, ankylosing spondylitis, things like that. But then the most common form of arthritis is called degenerative joint disease, or DJD, degenerative joint disease. And this type of arthritis comes from the bones just wearing out with overuse. Just like the tire being older and overused, the tire is going to wear out. But there's certain things that can accelerate this type of degeneration. And the degeneration is accelerated by increased friction. And that friction comes from alignment. So let's say your spinal bone is not in the right position, and every time you move now, it's creating excess friction on the surface of the bone below it and the surface of the bone above it. So over time, that excess friction is sort of just like my hands rubbing together like this. Now, if I were to do this for a couple minutes, no big deal. I just keep doing it. Hey, maybe it feels pretty good. I just keep doing it. But if you told me I had to do this for an hour, I'm sure the surface of my skin would start to be sore. It would start to inflame. And if you told me I was doing it for days, I would probably wear that surface skin down to where I'm creating blisters and all these other things. So it's the same thing with the spinal bone. If there's motion and it's out of alignment, that friction is going to wear the surface of the bone down. And we call that arthritis or degenerative joint disease. Now the problem with degenerative joint disease is that it's permanent. Once the bone has degenerated or eroded, it's not going to change. It's not going to go back to its normal healthy bone. So the goal here is reducing friction and preventing this condition from getting worse, or preventing it from happening. So as from a chiropractor's perspective, what we do is the spinal adjustments are designed to realign the spine, or more importantly, with the realigning, it's putting motion in the spine. And that motion is reducing the friction. And then over time, with the adjustments, we're able to correct the alignment, which reduces the friction. So what we can do is stop arthritic changes from getting worse. All right, so that's why in some cases you may have a 30-year-old who played a lot of contact sports, or had a job with a lot of repetitive activities, and if you x-ray the joints on the spine, there's a lot of arthritis. Many doctors would say, oh, hey, you have the neck or the back of a 70-year-old. Well, that's not good. And then there's times where you can x-ray a 70-year-old who hasn't had a lot of alignment issues, or haven't had a lot of repetitive use syndromes where they're wearing down the bone, and maybe their spine looks as good as a 35-year-old. But the bottom line is that the chiropractic adjustments reduce the friction on the spinal joint and prevent arthritic changes from getting worse. All right, so you're not that 30-year-old with the 70-year-old neck or the back, or that 40 or 50-year-old with the 80-year-old neck or back. So the tire is a great example to show you how alignment can cause problems with function, and then function then leads to structural changes that can, be life-threatening with the tire as far as a blowout goes. And over time, with your spine, now you have arthritis, right? So you don't want me putting up an X-ray and giving you the knock-knock joke. Knock-knock, who's there? Arthur. Arthur who? Arthritis. We don't want that, all right? So chiropractic aspect, when correcting subluxation, reduces friction on the spinal joints, and that prevents degenerative changes from occurring. All right? See you later.